Humanity. Order. Robin Miller.
Madam Deputy Speaker, I rise to speak in clauses in my name 60 and 61. And these very simply, Madam Deputy Speaker, put patients first. I'm thankful to the Right Honourable Member for West Suffolk for his comments on new clause 60. I don't seek to put that to a division, so I won't mention any more of that now. But turning to new clause 61, let me simply say this. Good data is needed for good services. Good data allows professionals and planners to assign resources and guide interventions where they're needed most. Good data allows patients to make informed decisions about where to be treated or where to live. Good data allows politicians to be held to account when services fail. Therefore, new clause 61, at its simplest, is about collecting and comparing data. It standardises the publication of a set of UK-wide NHS data, and it ensures the interoperability of that data. Unfortunately, in Wales, Welsh reporting standards mean waiting list statistics are not available for most procedures. Before the pandemic, it took a journalist's investigation in North Wales to highlight that patients were waiting for over 2 years for hip operations. And then constituents now report that they are being told they face a 2-year wait just for a first outpatient clinical appointment. This is distressing and disappointing, and it's simply because data is not available. We must ask ourselves the question, if for want of a nail the shoe was lost, what then are we losing for the want of good data? If the government is to bring digital transformation into the heart of the NHS, the Minister must know that heart can only be animated when good data courses through its veins. In the months I've worked with colleagues on this new clause, we have heard overwhelming support from patients. They agree. Healthcare professionals, IT experts and administrators have also told us they agree. In fact, I don't believe this is a clause which would divide the House in compassion or in common sense. However, I do accept there is a challenge in delivering it, and I know the government is exploring ways to address this. I note the Minister's comments at the start about close working with the DAs, and I welcome those. I'll give way.
To him for giving way, and I don't question the well intentions of his amendment and new clause. Does he believe that the standardisation would happen in conjunction with the four governments working together, or is it his view that this process will be driven solely from Westminster?
I thank the Honourable Member for his question. It's a good question, it's relevant, and I think it speaks directly to the heart of what the Minister said in his opening comments. There is a good collaboration and a consensus emerging around this, and I'm optimistic that that will be the case. In fact, my concluding remark was to say that I will not be pressing this to a division, but I will be listening very carefully to what the Minister has to say in his response. Thank you.